According to the CDC, the rates of suicide, self-harm, anxiety, and depression are up among adolescents.
Last December, the U.S. Surgeon General issued a rare public advisory warning of a, quote, devastating mental health crisis among American teens.
As COVID raged, another health issue hit teenagers across the country, a mental health crisis. But doctors say it's a problem that's been growing for years.
Many parents are once again wondering about the potential impact of the pandemic in their kids' mental health and emotional health.
Teens and young adults are in the middle of a mental health crisis.
Especially young people here in America. The youth mental health crisis is all too real.
Our kids have been struggling for a while, and we can no longer wait to address youth mental health in our country.
People don't schedule their mental health crises. They happen anytime, at any point, and we just have to be available, right? And so if it's Friday night at 9:30, if it's the day before Thanksgiving, if it's Christmas morning, we need to be there. Most people can't tell you the difference between a psychiatrist and a psychologist. How are they gonna know where to go? And if you pick up the phone book and you look at all of the places, you can call 1,000 and you might get 3 to answer, and one will tell you that there's an appointment available in 2 months. So that we just got to do better. So really what we born this whole idea out of was, could we create a new front door? Could we create something that's easy to get to, simple? Everybody knows we're always gonna say yes. Doesn't matter what your background is, doesn't matter what your insurance coverage is, doesn't matter what you think might be wrong. Just come to us and we're gonna help you. It's a challenge to try to ask somebody who's in mental health crisis how they're gonna pay. You just increase their anxiety, you make it more difficult to treat them. I think we've lost touch in healthcare in the last decade or so. We've been so in a rush to just check the boxes, tick off the things we need to do so we can get paid. And we forget that there's a person on the other side of this, and there's a service component to this. And so when you walk into a Mind 24/7 building, your first question isn't gonna be, how are you gonna pay? Or what do you think's wrong? We're gonna go, are you okay? And how are we gonna help you? I have seen patients and their parents come in and they come from loving homes. They go to the best schools, they have everything. They even may have therapist relationships and whatnot. But there's times at the moment, they're like, this is not my kid. I don't know who they are. I don't recognize this. I don't know what else to do. They've opened up their checkbooks. They've called every number. They've made every favor they can, and they don't have a place to go. And then they end up with us. And they realize this is where they should have started, right? Because they could have been home an hour and a half later with a treatment plan, a prescription, a therapist relationship, and knowing that their kid's gonna be on the path to getting better.
You see the desperation of the folks saying, I just want help. I don't care where you take me. I just want to go somewhere where they're gonna hear me and listen and make things better, and Mind 24/7 is that place. Hi, my name's Jessica Wesmiller, and I'm the Crisis Intervention Coordinator for the Chandler Fire Department. With children, there was a non-existent place other than the emergency room up until Mind 24/7 was present. So for years, the only option we had if folks didn't have insurance was the emergency room for kids. So they have opened the doors to a whole new possibility for kids in crisis.
When I've worked with parents is that they might feel scared because their child is throwing things at them, is pushing them, right? Because they're struggling from within, and the way that they're demonstrating that is through their behavior, and that might present either through verbal altercation or physical. altercation. The reason why Mind 24/7 is great in regards to the menu of options for parents and caregivers of children, adolescents in a behavioral health crisis situation is because it was built specifically for this situation. And so the compassion, the understanding, the lack of judgment, and really there to help support you through this very difficult time.
There was a lot of stigma about taking care of youth in the behavioral health world. They're harder, they don't make as much money, you have to deal with parents or guardians, and it's difficult. I would tell you, I think we found it different. We find it more rewarding in many cases. You get to change the trajectory of a kid's life. You get to keep a family together.
Our services are in the areas of group homes, employment and day programs, and fully integrated outpatient services. Hi, I'm Sharna Jaffe-Piper, CEO with Copa Health. In our healthcare system, the last 2.5, 3 years, kids with complexities in their care, typically kids who have behavioral health challenges, who are maybe in and out of homes, who have DCS involvement, don't really have a place that they can go to during a crisis. So Mind 24/7 really was quite innovative as it relates to providing that level of service where these kids can go for 72 hours or longer during a time of crisis, and those services can be provided without elevating it to the hospital. So I do envision a Mind 24/7 working very closely with organizations like Copa Health in that we are the sustaining outpatient provider for those kids, but they're able to receive them in real time so that they can get the services that they need.
I made a vow. I said, we're gonna build as many of these as we have to build. And we're gonna go change lives. We're gonna go save lives. We're gonna go save families like mine, right? And so that's why we do this. And that passion, that belief sits in every one of our team members. And it sits in all of our partners. And it's what really drives us.